Dr. Joanne Haupert, chiropractor, and I'm going to be talking to you today about Parkinson's. Parkinson's has a lot to do with our muscles and has to do with how well they're working, and typically there's a very low amount of dopamine which makes those muscles not work well. And I want to talk to you about early warning signs of Parkinson's. So there's 4 I'll be discussing in this part. The first one is a loss of the sense of smell. I've had quite a few patients come in, and they come in for other reasons, and they tell me, oh, by the way, I haven't been able to smell in years. And I am typically pretty alarmed, okay, because that is the body saying, problem, 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 okay? So we want to pay attention to that. Also, speaking more softly, right? The muscles in the larynx allow for us to speak, and if the muscles aren't working so well, we're not going to have the same projection. Also, disrupted sleep, okay? A sleep where you're having a lot of agitated movements, where you might be kicking or punching out. And I'm not talking about a one-time thing in a nightmare, but a pattern of more of that when you haven't had it. And then these kind of symptoms, and also your handwriting. Again, that's muscle related. You might notice that you're printing larger or printing differently. And you know, in our busy lives, we might not even think a lot about it. We might say, well, that's strange. But these are things to pay attention to. Your body is saying there's a problem. Pay attention. And one of the things you want to pay attention to is how healthy is your nervous system. Because your nervous system controls how the muscles work and the whole dopamine creation. So in our next series, we'll be talking more about Parkinson's.